the reason for this little bulb here is because it tells you, since this one is already inside the patient, you're not gonna be able to see that one inflate, but because this little blister or bag inflates, then you know that that one's effective as well, right? So if this one's inflated, that means this one's inflated as well. You check them both before you insert it to make sure they both work, but they should both inflate. So go ahead and connect your 10 cc syringe on there. Okay. Okay, blow some air into there. Okay, let's see. Oh yeah, you twist it in all the way. So you're gonna have to, before you twist it, make sure you pull this up. Okay, go ahead and twist it on there. Nice and firm, you have a little more pressure. Okay, there you go. All right, now try it. Okay, you can see that this inflated and so did this bulb right here, right? Now go ahead and retract the air again. Okay, you know that it's working. That's the first step you gotta remember, right? Then you need to identify the cricoid thyroid membrane, which we're gonna do it here, but then on top of that, cricoid thyroid cartilage, cricoid cartilage down here, cricoid thyroid membrane. That's gonna be your sweet spot, right? You see the Adam's apple, and then you're gonna go down about one ring after that, okay? All right, so what's gonna happen is for, just so that he can get the feel of how the cut is, I'm gonna move this plastic just a little bit to the side. All right, and then now you're gonna go ahead and you simulate, you know, that you've got your, just simulate that you have your gloves on just to save a little bit of time. Okay, and you identify, you make sure you have all your equipment ready. You've got your pieces of tape ready if needed. You won't in this case, but you'll have your alcohol swab or your betadine, you've got your scalpel, and you've got your cric hook. Okay, so go ahead and do that. Yeah, he's got his gloves on. All right, then you go ahead and do your, he's gonna identify his landmark. He knows that he's facial trauma and burns, so he doesn't have a choice, he's gotta do the cricoid thyroid process, right? Yeah. You identified your landmark, right? Okay, so you're gonna kind of tent the skin like this when you hold it down to make sure that it stays nice and taut. Okay. Right, and then you're gonna go into your insertion right below the Adam's apple, but before here, okay? So you're gonna do, she went a little more straight down, which is okay, but try to kind of like slit the skin a little bit vertical like this first a couple times. Okay. And then you're gonna poke down, and then turn to the side and poke down again. You're never gonna go like this, because you could risk either cutting your fingers, or you could risk, by doing this, I'm protecting their carotid artery and their jugular vein, you understand? Yeah. So that's why you just go, slice, straight down, turn, straight down, you understand? Okay. And only about a little bit of about no more than half an inch, quarter inch, half an inch, all right, ready? Okay.
I have a quick question.
Yes.
When you said turn, do you mean like turn inside?
No, you pull it out, you pull it, yeah, you pull it up, and then you insert, and then you turn it when it's out, and then you insert, yes. Okay. So yeah, be careful, okay, make sure, hold it in place, straight down, laceration, very, just a nice little slit to open the skin. It may bleed, don't freak out, okay, keep moving. All right, you slit it just a little bit, now you're gonna go straight down just a little bit. All right, then pull it back up, now turn to the side, insert again. Okay, and what's gonna happen is, he go a little deeper, just a little, okay. All right, what's gonna happen is he's gonna make sure if that membrane, there should be like a little pop. You're gonna feel a slight little pop, okay? Then once that membrane is there, like I said, trauma paramedics, they get the finger, it's not a sterile procedure. You can legit put your finger in that area. Go ahead and place your pinky in there. Yeah, preferably always going downward. Oh. Okay. All right. Yeah. Hold it in place there. If not, you're gonna go ahead. You remember safety, right? Go ahead and cover your scalpel up, set it aside. You can get the bottom part of this, and you're gonna hold it in place there. You can take your finger out if you need to. Okay, it's holding it open. Now you're gonna go ahead and take your cric hook. Go ahead and hold this one in this hand. Okay. Hold it here. Hold it by here. Okay, you're gonna take your cric hook. He's gonna put it on the bottom. He's gonna kind of bring it down and turn, and then you're gonna hold it open like that. Normally, if somebody else is in the area, one of the other airway trauma team persons, they can come and they can put in the tube while he's holding it open like that. You understand? They're gonna come in and bring the tube. So go ahead and remove that. And then in this case, we would transition Yeah, you can go ahead and
Okay.
just take that one out. And then in this case, he can transition into what would be the ideal, you would insert the tube right there and then, right? And then
Yeah.
connect the valve to it. For the purposes of you getting a better visual, you see where the airway is there on top, right? The top one is the trachea, the bottom one is the esophagus, okay? Your goal is to go ahead, and then now you're gonna go ahead and you would lubricate. Okay, go ahead and lubricate your bulb there. Here's a little more. Remember, try not to get the hole in there, just kind of move it around with the packet itself if you need to. All right, and then now you're gonna insert into that top hole there. Remember, at this point, you would still have the other plastic stem in here. Okay, that plastic stem would be in place. You don't want it to be occluded. Okay, go ahead and insert. Okay, go farther, because remember, normally you'd be all the way down here. So for these purposes, you're gonna insert it like this, right? It's normally would be setting up here. We're doing it like this for visual purposes, okay? It's already in all the way. Go ahead and take that plastic out. Okay, and then at this point, you would go ahead and I'll connect the BVM now before I put the air valve on it, okay? Basically, you're just holding this in place like this, and you would connect it there. Now I'm gonna insert, and then go ahead and inflate your bulb. Okay, that's good right there. You feel some resistance?
Yeah.
Okay, you set it to the side. Now go ahead and try to squeeze it very gently at first. No resistance, okay? As you can see, it's an effective airway management. Now, go ahead and, now you can do a full squeeze like that. One breath every 5 to 6 seconds, right? Okay, and now you're receiving your positive ventilation, okay? So, that's why, you know, these systems are very effective. So for you, those of you all that stayed a little extra, I'll just tell you, but we even have efficient airway expedient, airway management in a trauma setting that we can do. We can convert, this is a $216 to $266 kit. If you don't have enough in your aid bag and you have a massive casualty scenario, we have a system to where we can actually take the drip chamber from an IV bag and cut it in half and use that one as an expedient airway management, connect it into the cricothyroid membrane, and then it just so happens that the girth of that drip chamber is perfect for a bag valve mask to just connect to, and you can start ventilating straight like that if you needed to. You understand? That's just like for emergency purposes, but other than that, if anybody else wants to try it, you're welcome to.